Hey, I'm Dr. Rutherford, certified functional medicine practitioner, chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
And this week's keys to success is going to be on thyroid. It's going to be on the fact that most of our patients still have primary physicians, and a lot of those patients get annual checkups, particularly if you already have a thyroid problem that was diagnosed before you got here, and you continue to keep getting it evaluated, which makes sense, on a yearly basis or a bi-yearly basis with your GP. I think going through this program, I think a lot of data is thrown at you, and sometimes it's easy to forget or to get confused if you go to your doctor and maybe you get checked and they say, oh, you know, your thyroid is off, we need to change your medication or whatever. Particularly those of you who have been diagnosed with Hashimoto's thyroiditis. It's something that you might want to continue to double check with Dr. Gates under these circumstances. This is a very delicate situation. We're just trying to tell you what we see. We have patients come back who have gone by the recommendations of the lab test, that is the updated lab test, and we have seen that gone awry because.
Okay. We have to understand lab ranges, and you have to understand where we're coming from when we discuss a lot of your thyroid conditions. So namely, we have done many broadcasts on a condition called subclinical hypothyroidism, which is where they're saying that if someone's TSH value, now the TSH is where the hormone that comes from the brain, it tells the thyroid to work. So if your thyroid is low, that hormone increases. So it's an inverse relationship. This confuses everybody. So if your TSH is high, that actually means your thyroid is low. Okay. And now, with subclinical hypothyroidism, the range being currently used is any TSH over 3.77 is too high. And we have news for you. They're using new ranges out of Asia now, and South Korea specifically, where they're saying a TSH over 2.85 is too high, which is consistent with the functional medicine model, where most functional medicine doctors were saying a TSH over 3 is too high.
And if I could interrupt, that functional medicine model came from Harry Eidner, who is a molecular biologist who works for Biotics, and spent 10 years reviewing lab ranges and narrowing them until they started to look like the symptoms of the patient that was sitting in front of us.
And really, he took 10,000 people.
Yeah.
And he said, I want to look at lab ranges of 10,000 people and see what they're likely to develop over that 10-year period. And what he figured out was that if you constrict the ranges down, then you'll start to see patterns 10 years before something happens.
And even for those of you who are not out in this area, for those of you who are in this area, Renown is starting to adopt a lot of these lab ranges. Now, Renown is for those of you who are not here, they're the monster. They're the 800-pound monster in the medical block here. They are the biggest hospital in northern Nevada, seemingly primed to try to take over everything. They have adopted a number of these lab ranges.
Exactly. And so nonetheless, when we're talking to you about a thyroid problem, that's the frame of reference we're using. Now, you have to consider that your general practitioner may have been trained at a time where they did not treat you for a thyroid condition unless your TSH was over 8. So here we're talking about 2.85, 3.7, and your GP is saying, you know, anything over 8, that's when it's an issue. Below 8, and you're kind of borderline, but it's not really a problem. So this creates a lot of confusion for a lot of patients because they say, you know, Dr. Gates or Dr. Rutherford said I have a thyroid problem. I talked to my GP, he says I don't. Oh my gosh, I want to pull my hair out. Don't. You just need to watch this broadcast. You need to understand the frame of reference for where or from where we're all coming from. So that's really the story on your thyroid. If you talk to somebody and they say you don't have a thyroid issue, just say, take a step back and say, you know what, based on the new literature, I do have a thyroid issue, and it is a problem. And for anybody who has questions, including your doctor, Send them to our website, powerhealthtalk.com. Have them search subclinical hypothyroidism, where we did several broadcasts on this matter with lots of research articles attached for those who are scientifically minded to want to see where all this data is coming from.
Yeah, this is a huge issue. I mean, when we started figuring out chronic pain, there were 4 major areas that we realized that we needed to know. One was the gut, one was the immune system, one was the nervous system, and one was the thyroid. Mm-hmm. And so thyroid's gotten a lot of attention over the last 5 years. Hashimoto's, I think I would be accurate in saying, wasn't even an accepted diagnosis 5 years ago.
I would say it was accepted, but it was rarely rendered. It was.
Yeah, I would say it was. I would say practically it was not accepted. That we were told we were crazy. That the endocrinologists
when we were talking about it, yes,
exactly. Mm-hmm. Now I'm not seeing that at all. I'm seeing people running numbers for it. I'm seeing people coming in here with diagnoses of Hashimoto's. But the treatment aspect of it hasn't caught up yet. And that's not me saying that. That's the Mayo Clinic saying that. But we also have observed that. So this can be a very confusing area. So I'm just saying, if you went through the program, you got good results, and then somebody's wanting to change that based on a lab value that may still be old lab values, or still wants to start altering medication without taking into consideration the autoimmunity aspect of it, you might just want to double check with Dr. Gates first. Mm-hmm. Would that be?
That's accurate.
Okay. Just to try to keep you on track, because once you take that and you get off a track,
right,
bad things can happen, and we can get you out of it, but it doesn't take as much as maybe a phone call and a visit to say, is this right? What should I do? Where do I go? So on and so forth. So, okay. That's our success key of the week.
And we will see you next week.
All right.